Indian warlord, chieftain, Elizabeth Warren, spreading more lies on the issue of abortion in the lead up to a very consequential election, of course, talking about women being forced to bleed out in hospital parking lots because of pro-life laws, talking about poor families who have to hold a dead baby who was maybe had clubbed feet or had some disability because they weren't able to slaughter the baby in the name of radical feminism in the uterus because it's all the fault of pro-lifers. These sick, evil, twisted people. Guess what? People who murder babies, they're generally not troubled that much in their conscience by lying to you. I know, it's shocking. Dr. Brent Boles, a favorite of the show here at the Seth Gruber Show, an OBGYN and practicing physician, joins us today to debunk so many of the medical and legal lies being spread by Indian warlord chieftains like Elizabeth Warren and many others seeking to, we all know the agenda, get Kamala Harris elected. Let's get those moderates to believe all of our lies, that it's pro-life Republicans murdering pregnant women so that they vote for Kamala Harris. Doesn't matter how much we deceive people as long as we get power. Dr. Brent Boles joins the show today to debunk all these lies. This is one of the most helpful episodes to share with people and to inform yourself how to speak against these lies, because we need all of you rebutting these lies on social media and to your friends in your life, okay? In the lead up to an election, which if it goes the wrong way is going to decimate the pro-life movement, destroy and endanger the lives of preborn children, and I think fundamentally alter America, possibly to a point of no return. We need to fight for life, and we need to fight against these lies. We're going to equip you today on this episode with Dr. Brent Boles. Welcome to the Seth Gruber Show. Dr. Brent Boles, the man, the in-house OBGYN expert here at the Seth Gruber Show. Been too long since you've been on the show, brother. Thanks for joining us today to talk about all the stupid lies from Indian warlord chief Elizabeth Warren and every other left-wing Democrat politician who is putting the deaths of pregnant women at the feet of the pro-life movement, because you know how much we hate the healthcare of women in the pro-life movement, Brent, right? I mean, we just want to save that baby, and if saving that baby means intentionally endangering the lives of women, that's what we're all about, right? You wanted to address some of these lies that are being used, I think it's fair to say, brother, to actually siphon votes away from Trump, from otherwise pro-life voters who believe those lies, and so they think that they have to vote for Kamala Harris. Where should we even begin this conversation?
There's so many places where you could begin this conversation. It's like shooting fish in a barrel. You know, there's just you're going to hit something every time you do. I would like to discuss one talking point that they have really, really harped on. Kamala Harris has done it. Everybody, you know, underneath her in that left-wing food chain is talking about it. And that's the unfortunate young woman who died in Georgia recently. Right. You know, they're eager to seize on that because Georgia has passed an abortion ban that prevents the intentional killing of a living child still in the mother's uterus at, I believe, 6 weeks. So that, you know, that pro-life law, you know, respects and acknowledges the fact that it is a living human being whose life is at stake, and it simply strives to protect them, but it doesn't do so at the expense of the pregnant woman, because the laws in Georgia, just like the laws in every other pro-life state, include exceptions for the life or the health of the mother. You know, if her life is in danger, if she is in danger of, you know, permanent impairment of any body function, then she can receive whatever care she needs. That is true in Georgia. It's true in Florida. It's true in Texas. It's true in Tennessee. It's true in every state that has acted.
Dr. Brent, I mean, the Washington Post, New York Times, and the Atlantic, I mean, you know, they speak truth to power. And they told me that woman in Georgia, it was because of Georgia's almost abortion ban. right? That's what they told me.
Well, if you want to believe the Washington Compost, then, I guess you can do that. But that's what they print is worth about as much as what you would find in a compost pile. So it's just ludicrous. The text of the laws in every state that has passed a law protecting unborn human life since Dobbs are very clear. Doctors, physicians, healthcare providers have the freedom and the latitude to exercise their clinical judgment and intervene in a disease process to protect the mother's life and to prevent permanent impairment of any of her bodily functions. Wow. Now, that doesn't go so far as to do what Roe and Doe did, which says if she's not going to be financially healthy because she doesn't want another kid, then she can kill the kid. It doesn't go that far, but it does allow physicians like myself to take care of women when they come in with problems. And every single person that says that providing miscarriage care is the same as providing abortion is a friggin' liar or an ignorant moron. There's just no other way to say it. They say all kinds of hateful stuff about us. Why wouldn't I speak truth when I'm sitting here talking to you? Those are the facts. I've just about given up on social media trying to speak to people who say, oh, well, abortion or a miscarriage is a spontaneous abortion. So getting care for miscarriage is an abortion and it's illegal in these states. And no, it's not. I've produced the pictures of the code sets from the ICD-10 diagnosis coding terminology, from CPT, the current procedural terminology coding for medical procedures, miscarriage care, ectopic pregnancy care, and elective induced abortion are in 3 different code sets for their diagnoses and 3 different code sets for the reporting of the procedures.
I want to thank our sponsor of the Seth Gruber Show, Every Life Diaper Company. Every Life is America's pro-life diaper company because all of the 8 major baby brands and diaper companies actually financially and or rhetorically support the abortion industry. So the diaper companies that make their money when Americans have more babies are also the companies that support the killing of babies. Wait a second. That doesn't make sense. Don't you want people to have more babies because you'll sell more diapers? You would think, but that's what the woke mind virus does to you. It makes you really stupid and makes you prioritize human sacrifice over free market capitalism and making money. So you need to fight back against the culture of death by fighting with your wallet, by not giving your money to woke baby-killing companies who hate you and your values and the unborn babies in America. Get your diapers and wipes from everylife.com. Everylife.com. Use promo code Seth10, that would be Seth10. And will you do me a favor? Will you send this to the person who runs the nursery at your church and make sure the church is getting all the diapers from Every Life? Promo code Seth10. You help the White Rose Resistance and the Seth Gruber Show as well, and you get 10% off your first order. Promo code Seth10, everylife.com. Thank you, Every Life, for being a partner of the Seth Gruber Show.
Even right. ACOG and Planned Parenthood have said on screenshots I've taken from their websites, they may have scrubbed those things by now, but yeah. Yes, I've got them, and it says care for an ectopic is not an abortion.
They
care for miscarriage is not an abortion.
Is fundamentally different than care for abortion. And I've said this on my show before, Dr. Brent, but since you brought it up, let me just remind you, because you probably know this, but let's just say it, okay? 2022, June, Roe is overturned. July of 2022, weeks after Roe v. Wade is overturned, in 2022, what starts happening? The left-wing activist media, I call them journalistic prostitutes or whores for the culture of death, and the Democrat Party team up to spread this lie that now that Roe is overturned, in any states that have a pre-Roe abortion ban on the books, any woman who has a miscarriage or an ectopic pregnancy won't be able to have the baby removed from the fallopian tube or the dead miscarried child removed from the uterus, because those services or surgeries are technically abortions. And so Planned Parenthood had a line on their website right before the overturning of Roe, and it said, treatment for ectopic pregnancy is fundamentally different than treatment for abortion. Roe is overturned. 2 weeks later, that sentence is no longer on their website.
They scrubbed those things from their websites. Yes, they did. And obnoxious abortionist Dr. Jen Gunter stopped tweeting about how ectopic care is not an abortion, because she was eager to lecture people when they would try to equate the two. And she would say, I've got one screenshot of a tweet. Well, I'm the expert and I know it's not.
That's right.
You know, those are the kinds of
you. You've had plenty of run-ins with her on X. Huh?
Well, just one. It was not hardly a run-in because she blocked me. I brought up a scientific point, and that included no religious element, no faith-based element, strictly science and medicine. And her response was, I'm not coming to the church basement to debate you, honey. That's below my pay grade. And then she blocked me. So she didn't have the nerve. That's an abortionist. And she did the same thing to another good friend of mine who's an OBGYN as well, Dr. Omar Hamada, who has really good guy. He and I were actually trying to debate her about the very same point, the very same night, and she blocked both of us rather than engage with someone who had the knowledge to contradict her.
Dr. Brent, let's put this in the real world. Let's put some flesh on this, what we're talking about right now, because Elizabeth Warren is saying this, Planned Parenthood saying this. Basically, like, all of the major influential voices in the Democrat Party are saying this, that pro-life laws are leading to the preventable deaths of pregnant women. So here, you're Dr. Brent Boles. You're in Florida. A woman takes the abortion pill. It's unsuccessful. The baby is not discarded from her uterus. And now she has the cadaver and dead body of a baby in her uterus. And she comes to you. And I guess you would have to just like not do anything, right? Because otherwise you'd be performing an abortion, right? Put us in the real world of an OBGYN in conversation with a woman in that horrific scenario.
In the real world, when a woman has visited an abortionist or has contacted them online and has received her abortion pills, either in person or by mail, or she's gone to a clinic that performs a surgical abortion and they leave any tissue, or the medication process is incomplete and there's remaining tissue, if the baby is dead, or the baby is already expelled and there's only placental tissue left and that's causing her a problem, taking care of her is not performing an abortion and it's not participating in the process. So when I do, as I have done many, many times, a D&C to remove retained tissue from a woman whose abortionist gave her the pills, it was an incomplete process, but it killed the baby, and then she comes to my emergency room because she's bleeding out, and she has a fever, and she's septic, and I give her antibiotics, I give her a blood transfusion, I do the D&C to evacuate the rotting tissue that the abortionist won't touch.
Wow.
I'm not performing an abortion, and the pro-life laws in the state of Florida where I live don't prevent me from taking care of her. Even though I'm a pro-life doctor and I'm working in a Catholic hospital, I do not have anything that has ever delayed me taking care of a woman who comes in with a complication from a miscarriage or from a botched abortion, and the abortionist won't touch her. Here's an interesting statistic. My one hospital where I work in the city where I'm at is very busy. We see tons of women in the women's ER. Before Florida's abortion ban kicked in on May 1st, there was hardly ever a week that went by when I didn't see one or two people who came to my emergency room for complications from surgical and medical abortions, and I would have to take care of them. Sometimes because they were too creeped out to go back to their abortion provider, or sometimes because they actually called their abortion provider And the abortion provider said, oh, we don't have an appointment for 3 more weeks. You just need to go to the ER. They won't see them.
These were
These
your
abortion
patients.
providers.
These were your patients who told you that some of them had called the office of the man who performed the abortion because they're saying, I have complications. I'm hurting. Something's going wrong. I'm bleeding, whatever. And they said, we don't have room for you. That's what you're saying.
Yeah, we don't have room for you. We don't have an appointment. We don't have an opening for 3 weeks.
But they told me that abortion was safer than childbirth.
Yes, of course they did. So, but, what I was saying, prior to Florida's 6-week rule, there was never a week that went by where I didn't see 1 or 2 people with abortion complications. Do you know how many people I've seen since May 1st with a post-abortion complication in my emergency room?
Of this year? Wow.
May, June, July, August, September, and now half of October. 5.5 months since Florida's ban at 6 weeks kicked in. And all of a sudden, I'm not seeing people in the emergency room with complications from abortions. The only one I've seen was somebody who got it in the mail from an abortion provider that was willing to break the law and mail it into a state where it's not allowed. And she had a complication, and I took care of her. So this whole narrative about women in pro-life states who now take abortion pills that they're forced to get online, their lives are in danger because they can't get care. It's a false narrative. It's fake news. It's disinformation. It's all those things that they accuse us of peddling. So the woman in Georgia obtained this is what I know from what I've seen online. Of course, I haven't seen her medical records, so I don't know exactly what happened. But if the account of what happened and when it happened is true, that she was early pregnancy, she obtained chemical abortion from an out-of-state provider she either went there and got it or had it mailed to her. She took it in Georgia. She had complications from her elective induced abortion. She went to a hospital. They waited too long to evacuate the remains of the baby, of the placenta from the uterus, and she became septic and died. She died for 2 reasons. One, she got an induced abortion.
Yeah, exactly.
Had she not gotten an induced abortion, she'd be alive and close to her due date now. Second, she died because somebody who didn't know what they were doing delayed her care. If that's truly what happened. And here's something.
Worse yet, Dr. Brent, is some of these are pro-abortion leftist doctors who see an opportunity to let a pregnant woman with an unsuccessful abortion die so that they can get national news media coverage as an opportunity to smear pro-lifers.
If they'll kill babies to line their pocketbook, why wouldn't they let a grown woman die to advance their cause? So here's an offer I'll make to anybody that knew her or cared about her. If you want to make her medical records available to me, if you're going to sue the providers involved, have your plaintiff's counsel contact me. And if they contact you to get my contact information, feel free to give it to them. If they'll send me her complete medical record, if there was truly malpractice there, and I suspect it was because there was no reason to delay, as a pro-life doctor in a Catholic pro-life hospital, I take a woman like that to the operating room within an hour of the time she presents to the hospital, and I take care of her. And I've never lost anybody like that. No doctor I know would have ever delayed in a situation like that. So If there truly was a problem, I will be happy to serve as an expert witness in a malpractice case against the doctors who let her die.
Good.
Just like I've testified against abortionists, including one who performed an abortion at nearly 20 weeks. The woman bled so much from the abortion. They talk about us causing people to bleed out in parking lots. This woman bled so much that when they rolled her out to her car in a wheelchair, she tried to stand up from the wheelchair and she collapsed in the parking lot from blood loss. They rolled her back inside, looked at her for a few minutes, and then took her back outside for the second time, put her in her car, sent her back to the hotel she had a room at, where she went into cardiac arrest and died.
Wow.
The only women bleeding out in parking lots that you can prove it happened are women who bleed out in abortion clinic parking lots, not the parking lots of hospitals that delay care because they are involved, because the patient has an abortion-related complication. It's just insane. So to the people who cared about this young woman in Georgia, if you're going to pursue litigation against the providers involved, have your attorney contact me. I'll look at it, and I'll be happy to testify against them if they really should have taken her to the OR sooner. I can't swear for 100% that that's what happened because I don't have access to her records. Wow. But if they want to have me look at those, I will be happy to do that. So what they're saying right now, the narrative that they're focusing on right now is this woman in Georgia died because a pro-life law prevented her from accessing care when she had a complication from an abortion. Well, let's roll back the clock 3 years to when COVID was in full swing. And the abortion industry pushed the courts to force the FDA to relax restrictions on mailing abortion pills to people who were too far from an abortion clinic. The whole narrative that they pushed then was there are so many women who, because of COVID, can't get out and can't make it to an abortion clinic, and they don't have anywhere in the local area where they live that can take care of them. So this abortion pill is so safe, we should be able to mail it to them, even though they may be hours away from a place where they can get care if they have a complication, because they're not going to have any problems. They're not going to have any problems. Yes.
During COVID, we talked about this. They pressured the courts and said, we need emergency use authorization. We need to be able to send this via snail mail now because of the scary COVID thing. And this is the healthcare for women. And then it became permanent after Biden became permanent. Mail order. It's so safe. You can send it through the mail to rural communities where they're an hour or 2 hours from a hospital. So anyways, just to remind everyone, this totally happened.
It did happen. It's all you have to do is look it up. Look up the court cases. Look at what the FDA did. So they say this drug's safer than Tylenol. Women are not going to have complications from this. It is so safe that we can mail it to people who are 2 or 3 hours away from the closest health care because their lives are not going to be endangered by taking this. But now they say pro-life laws and pro-life states are causing women to die because when they take these pills and they're not close enough to a place that can help them, they're going to die. Well, which is it? Which one is it? It's one or the other. And I'll tell you which one it is. It's dangerous to take the pills because that young woman in Georgia would be alive today if she had not been given mifepristone.
Well, and yet, Dr. Brent, here's what Elizabeth Warren tweeted out as everyone was talking about this woman who died in Georgia. I believe she was pregnant with twins. When she drove to North Carolina, got the abortion pill, drove back to Georgia, took it there. Here's what Indian warlord chief Warren put on Twitter. The Trump abortion bans endanger women's health and lives. No doctor should have to tell a woman in the middle of a miscarriage that she can't get the medical care she needs because she's not near enough to death and she needs to hemorrhage in the parking lot a few more hours. I believe that got hundreds of thousands of views, likes, quotes, retweets, and she's a sitting senator.
Nobody holds them accountable. You know, the whole abortion industrial complex and their media cronies, it's such an uphill battle to get any truth out there. But so define miscarriage. Well, a miscarriage is when the child in the uterus has died and maybe has passed, maybe has not passed. Once that child's life is no longer here, once that heart has stopped beating, taking care of her is not prevented by any law that prevents abortion, because performing an abortion has one goal: preventing a living birth. Taking care of somebody who has a miscarriage is providing medical care to somebody that needs it. The two are not the same. They continue to say they are the same just because some miscarriages are treated with a D&C, a dilation and curettage, and I crack up when ignorant idiots on Twitter abbreviate that with the capital letters D-N-C. I see that so many times. That's the political organization that promotes this deadly crap, but it's not a D&C. It's a dilation and curettage. So that's why we say D&C.
But it's funny, though. It is funny. It's like, I think that's got it as providence. Yeah. Like the Democrat National Committee, you say D&C, and they literally were hosting abortion buses outside of the D&C that perform D&Cs. That's like hilarious and dark. Yeah. But anyways,
it is. It's kind of like divinely humorous as well. That Scripture says, "Sheep to the right, goats to the left." That's. I mean. Yeah. Anyway, but
it's like Scott Wiener in California, the lawmaker who's behind reducing penalties for rapists and pedophiles, and his last name's Wiener. It's the same thing.
Yeah. So when people say, but you can't do a D&C for a miscarriage because it's the same thing as an abortion. No, because you use a procedure to achieve the goal of treating a miscarriage. And that procedure is also sometimes used by abortionists to perform an induced abortion. That's saying that those two things are the same is like saying that cremating a corpse is the same thing as burning somebody alive at the stake. Yes, they both use fire, but cremation of a corpse doesn't kill anybody, and burning someone at the stake kills them in the most brutal way imaginable. And that's what abortion does.
That's the best example I've ever heard.
It's true. It is so completely true. So performing a D&C to take care of a miscarriage is not prevented by any pro-life law, and that's just equivalent to using fire to cremate a corpse. Performing an induced abortion is just as painful for that little baby as tying somebody to the stake and lighting the fire and watching them scream as they die. It's the same thing, but they won't acknowledge that. So, back to just that point, is it safe to mail abortion pills to a woman who lives in an area where healthcare is remote or not? We know it's not. The young woman in Georgia died because she took mifepristone, and then she happened to go to a hospital where that was not prevented by a pro-life law, but where she ran into somebody who committed malpractice and caused her to lose her life.
Yep. Well, and let's say, too, for everyone listening, I say this every time I have you on, Dr. Brent, but I think it's important to repeat over and over and over and over again for clarity of communication purposes. Abortion is never safe because it kills little babies. We're not talking about the alleged safety of abortion in regards to the unborn right now. We understand that talking about safe abortions is like talking about safe child abuse or safe spousal abuse. Obviously, it murders a baby. But we're exposing the lies of the medical industries, the abortion industry, and the political powers that are seemingly excited and ready to intentionally endanger the lives of women that they say that they're there to serve and love and protect, so that they can become sort of political sacrifices on the altar of abortion access. That's why we're talking about the lies of those who claim abortion is safe, because those who murder the unborn are just as happy to endanger the lives of the born if it will allow them to protect their core sacraments, the sacred cow of abortion. But there's something about Lion Lizzie, isn't there? Elizabeth Warren. I mean, I used to say, and actually an independent auditor or an independent agency rated Kamala Harris when she was senator in California, the furthest left, most radical senator in the Senate. I don't know now. I mean, she's not a senator anymore, but Elizabeth Warren is the woman, guys, who a day or two after the overturning of Roe versus Wade called to shut down every pregnancy resource center in America because she said you shouldn't be allowed to torture pregnant people like that. Now, we used to call pregnant people women, but I guess she's talking about, trans men's abortion rights. I don't fully understand it. But Elizabeth Warren is probably the most radical senator, pro-abortion senator in the Senate today. We already acknowledged her first lie, but you sent me this today, brother. She just posted out here an article from CNN saying Biden administration to propose expanding access to over-the-counter contraception at no cost. Infants dying at higher rates after abortion bans in the U.S., research shows. And Elizabeth said the two visions of government couldn't be more different. Trump's abortions bans cause more infants to die in the arms of their parents. The Biden-Harris administration's actions protect and expand reproductive rights. What is she up to now?
Well, she's utilizing a common tactic. And just for a little clarity on something you said, yes, you said she's the most radically pro-abortion person in the Senate. She's the loudest.
Yeah.
She's the loudest one right now. But every Democrat in the Senate votes without exception to advance abortion rights. They all vote the same way, lockstep like Nazis. Yep. They do not deviate from their marching orders because Planned Parenthood spends about $50 million every election cycle on getting them reelected. Wow. So, of course, they do what their blood money masters tell them to do. But yes, she made the point that some babies are now dying in their parents' arms because their parents couldn't get abortions. Well, she's referring in just
such a
very
weird phrase.
Yeah, she's referring in such a poorly worded way that that when a child is diagnosed in utero with a lethal anomaly or a lethal disease or a lethal genetic defect, that it's just such a shame that they couldn't be murdered in utero instead of being delivered living and then getting comfort care and allowing their parents to mourn and grieve. So here's what most people don't realize. There is a thing that's available everywhere called palliative or perinatal hospice. Yep. And the American Association of Pro-Life OBGYNs, you and I've talked about a lot of the work they do before. They have a very nice resource on their website that talks about perinatal palliative care. Their research shows that when a family faces the diagnosis of a lethal anomaly for an unborn child, that when you look at the outcomes for families that choose abortion versus the families who choose to allow nature to take its course, allow the child to deliver by standard obstetric delivery techniques whenever it's time, and then providing comfort care for the child and allowing the family to hold the child and bond and take pictures if they wish and have more closure, that those families are more psychologically and emotionally sound and healthy much faster after delivering their baby and providing comfort to their child than they are if they stick the baby in the heart with digoxin or dismember the baby alive. And then there are no pictures. Why do you want pictures of a dismembered baby as a keepsake? So perinatal palliative hospice for perinatal patients like that is healthier for the patients. It's more emotionally healthy, and it's medically healthier. The whole garbage about abortion being 14 times safer than childbirth, even a first trimester abortion is 4 times more likely to cause death than standard obstetric care. That's inarguable data from Finland's extremely sound database of millions of people. Yep. Then there's also the data that shows that for every week past 8 weeks gestation, the risk of death to the mother for having an abortion goes up 32%. Wow. So if she has an abortion at 10 weeks instead of 8 weeks, well, it's gone up 32% for each week. So imagine that 32% increase in risk. And this is like compounding interest. It just grows exponentially. So a woman who's having a mid-second trimester termination because at 20 weeks she found out her baby has Down syndrome, she's like 80 to 100 times more likely to die from that than she is from childbirth. Jeez. And so this is what they want. They want abortion all the way to the due date, without limitation, and they ignore the very sound data that says for every week past 8 weeks, there's a 32% increase in the mother's risk of mortality from having the abortion.
Oh my God.
This isn't about women's health care. It's about lining the abortionists' pockets.
Yep. These are earth-shattering statistics.
Yeah.
And they prove what we know, Dr. Brent, but what the broader public doesn't know, which is we're not dealing with like good-hearted, reached a different conclusion, but fundamentally reasonable Americans who just differ on whether we should slaughter children in the name of radical feminism when they're six inches away in their mother's uterus. We're actually dealing with a death cult who will not stop their agenda of death anywhere. There's no limiting principles to this. I mean, these people have made so many billions on the killing of babies. Why would they suddenly get honest about what abortion does to women when they know it's going to drastically decrease the abortion rate? I mean, you and I have talked about this, and I just talked about this on the Alex Clark show, Culture Apothecary. But you just providing new statistics that are just so shocking that it should cause every pro-choice person to start picketing outside of abortion clinics, even if they don't care about the baby. If only because they're like, oh my gosh, women's health care in America is going down the drain because of what abortion's doing to women's health. Why didn't you tell us these statistics? Shocking.
It is shocking. And, organizations like the Susan Komen Foundation. October's Breast Cancer Awareness Month. There are buildings lit up pink. The hospital where I work, some of the lights around the building at night are pink. They always are every October for Breast Cancer Awareness Month. And I'm seeing Susan G. Komen ads on television. This one local construction company is, tooting their own horn because, hey, it's Breast Cancer Awareness Month. We donate to Susan G. Komen to help advance the cause. Well, Susan G. Komen gives money to Planned Parenthood.
And vice versa. And they're pro-abortion. Yep.
And you've talked very, very expertly and extensively about the increased risk of breast cancer from induced abortion. The data's inarguable. 75 studies around the world, peer-reviewed publications. More than 2/3 of them say there's definitely an association between induced abortion and an increased risk of breast cancer. And Susan Komen ignores it, raises money to fight breast cancer, and contributes to the primary cause of breast cancer in the United States.
Yep. Yeah, that's wild, isn't that? It's shocking what you said, Dr. Brent, about the research into the psychological health of families between those who killed their baby in the womb because they weren't fit enough, and those who delivered the child. And if the baby did have a terminal diagnosis, to enjoy what time they have with the baby as they say goodbye. That the research into the psychological health between those two different sets of families is shocking. Can you say it again for our listeners?
Perinatal hospice is a strategy that provides palliative care to infants born with lethal anomalies or lethal diseases or genetic defects. Basic obstetric delivery techniques are used to deliver the baby in the safest way possible for the mother. And sometimes a child with these kinds of issues doesn't survive the delivery process. But if they do, then they're held by their parents. Their parents speak to them. We know that newborn babies recognize their mother's voice and their father's voice. Their families talk to them. They get to bond with them and hold them and feel good about providing comfort care for them. And if the child is really suffering, medical professionals stand ready to administer sedatives and pain medication and things like that to ease this child's transition from living to passed away. So very different than stabbing them in the chest with a needle in utero to stop their heart, or not even stopping their heart and tearing off their arms and legs while they're still alive and pulling them out in pieces. Which is more kind to the baby? But then you've got the people who are like, they don't care what's kind to the baby because they think it's still a clump of cells. and they don't regard it as a human being and as a person. Well, then you have to argue with, then you have to have them justify why it's not better to want this family to grieve more easily and to heal more rapidly and completely afterwards, because the statistics prove that measures of emotional health and recovery after grieving a loss are far superior in the perinatal hospice population than they are in the abortion population.
Wait,
and I've used this service.
Are you telling me that like people, like when you murder babies, it's harder to recover than from people who don't murder babies? This is,
if you understand,
I'm so shocked.
Yeah. If you understand what's being done and you have a conscience, yes, it is easier. I guess if you don't give a crap about anybody or anything except your own comfort, and that brings up another point. They always like to say that people like you and me are all about control. We just want to control women. I don't want to control women. I don't want to control anybody. I just don't want people to kill babies. Just like laws prevent homicide in other settings. A civilized society wants to prevent one individual from harming another. Yeah. That's not about control. That's about being civilized. It's the abortion side that's about control. Yeah. Achieving such tight control over their own current situation so that they can not experience what they view as an inconvenience due to the birth of a child. It's about such an extreme degree of control that it always results in the death of an innocent person to exercise that control. There's where the control comes in. Yeah. It's not pro-life people that are doing anything to control anybody else.
That's right. Killing turns out is a form of control. That control just happens to be deadly. Dr. Brent, one thing I was disappointed in, in a similar point here, Brett Kavanaugh, during his confirmation hearing, do you remember when Kamala Harris was asking him questions? And she said, and by the way, she repeated it. No. She just appeared on the Call Her Daddy podcast, which apparently is like one of the biggest podcasts in the country, which is really an indictment on our culture right now. And so her name's Alex something, and her podcast is Call Her Daddy. And she had Kamala Harris on as people were drowning in North Carolina during the storm. And the podcast host asked Kamala Harris, can you think of one law anywhere in America that in any way tells a man, and then Kamala Harris interrupts and goes, oh, I know what you're going to ask me, ha ha ha, and she does her demonic cackle, tells a man what he can or cannot do with his body. Well, the reason that the Call Her Daddy podcast host asked Kamala Harris that is because that's what Kamala Harris asked Brett Kavanaugh. Do you remember this at the confirmation hearing? And I was really disappointed in Brett Kavanaugh. He I don't think he understood the question. And he said, what do you mean by that? And she asked it again. And then he said, no, I can't think of one law. Really? I could think of lots of laws. I can't beat my wife. I can't rob a grocery store. I can't drive my car at 100 miles per hour. I can't streak through the local park naked with no clothes on. Almost every law controls my quote-unquote right or freedom to do something that I could think up in my head with my own body. Like, all laws legislate morality. What the heck are you talking about? We're not controlling anyone by saying you can't kill a baby. So anyways, to bolster your point, but they do this one all the time, and they're trying to, what kind of law tells a man what he can or cannot do with his body? I don't know all of them.
Yeah, exactly. And, that brings up another good point. She has repeatedly showed her absolute utter contempt for people of faith. She did it with every Catholic judge that she grilled during confirmation hearings while she was in the Senate. And she did it last week at a rally where there was a competing Trump rally down the street, and a couple of pro-life kids were in the crowd, and they yelled, Jesus is Lord. And she called them out and then threw them out and said, you're at the wrong rally. Yep. You belong at the smaller one down the street, which none of his rallies are ever smaller than hers anyway. So it's not, and everybody knows that. But the whole Call Her Daddy thing, who does she call daddy? Willie Brown? I mean, what are we talking about? Why was it a good idea for her to go on that podcast I'm just.
Oh my gosh. I mean, you're exactly right. And for those who didn't just understand what just happened, this is why I say Kamala Harris was that was really the first Margaret Sanger. She too learned how to sleep her way up the levers of power. But
Yes.
anyways.
Yes.
Dr. Brent Boles, I think we'll land the plane right there. Thank you for joining the show today and debunking all of these lies. It's so important that we get this out there
Yes.
to the lay moderate voter who looks at Trump and kind of goes, ah, and looks at Kamala Harris and goes, ah, and they're persuadable. But they're being lied to. That voting bloc is being lied to. And we hopefully got some truth out there today for you guys to share with people. Dr. Brent, will you come back on the show soon?
Yes.
All right.
Name a
Well,
time.
thank you. Thank you for joining
right.
us today. Thank you guys for joining the show. Head on over to iTunes, Spotify, YouTube. Give the show a rating and review. And don't remember, go to Rumble and subscribe for when Google digitally assassinates me on YouTube. Hit 5-star on iTunes podcast. Leave us a review. It really helps. Pick up the book, The 1916 Project, at the1916project.com. And host a screening of the film at your church. The film is screening right now on X. On our X Twitter account, 1916 Project Film. 1916 Project Film. Reshare it. Tag Elon Musk. Tag Tucker Carlson. Help this go viral before the election to show the agenda that was focused on who Margaret Sanger and her friends defined as the unfit, okay, the undesirables, or to quote Hillary Clinton, deplorables and irredeemables. The1916project.com, and sign up to join us in Washington, D.C. on January 23rd, the day before the March for Life in downtown D.C. for Life or Death Con. LifeOrDeathCon.com. Pick up your tickets, but if you're an ally of the White Rose Resistance at $35 a month or more, you get your ticket for free. Come to Life or Death Con on January 23rd and hear Ali Bestucky, Eric Metaxas, Joshua Broom, Dr. Nancy Piercy, Dr. George Grant, myself, and many others as we wake up the church to take back life and give God a reason to show America mercy. Join us at the White Rose Resistance at thewhiterose.life or the1916project.com. Until next week, I'm Seth Gruber, and this is The Seth Gruber Show.